OK, thank you. We've got Dr Sharandeep Singh with us, who works in the NHS, also co-founder of the Sikh Food Bank. Good morning, Sharandeep.
Good morning.
Good morning. I mean, Mr Swinney, they are saying, when I asked him to sort of sum up the NHS, and I do appreciate that it is a big ask with such a vast service, but invariably he feels that people get a good experience of care when they get into NHS services, but its access is a problem. Too long to wait for a GP, too long to get urgent care. Would you agree broadly with that assessment?
I would agree that access to care is a big problem, and one of the things that I'm noticing now as a doctor on the front line in my own personal professional career, and also the situation that many of my fellow doctors are in just now as well, is that after years of studying, years of undertaking rigorous exams, hard work in the NHS, there are many doctors now that are actually throughout their career struggling to find a job.
Really?
I think that listeners would be horrified to understand and know that there are dozens of doctors that I know personally that are putting in application after application after application to work as a doctor in our NHS in Scotland, and they're not even getting through to an interview.
And what reason is given?
There's no jobs. No jobs available, Kay. There are places I know, hospitals across the west of Scotland, where for one job there are 200 doctors applying for it.
Mr Swinney?
Well, I'm going to take that away and explore all those issues, because there will be, there are vacancies in doctors' positions, and we report on vacancy statistics. So my initial reaction
those vacancies, First Minister, though, those vacancies are for very specific specialised posts, and as you'll know, it takes over a decade for us on a journey to go through to get to that point. And what we're seeing now is blockage after blockage after blockage for some of the cleverest people that have gone through the Scottish education system and have excelled and have really worked hard and proven themselves time after time, and there's blockage after blockage after blockage for us to get access to the specialist training we need to be able to provide the highly skilled services that we provide.
Okay, well, look, I'm going to take that. I'm going to take that away, because that's, my kind of, the logic in my mind would say we've got vacancies in the health service, and we've got people who are trained to come into those vacancies. If we haven't got the right arrangements, pathways, if there's blockages, then I spend a lot of my time confronting blockages in the system of government and public services. So I'll take that one away. I obviously want to make sure we've got opportunities for trained doctors to make their contribution to the health service, and we need them, because we need that capacity. I had my weekly health service review meeting yesterday, and I was pressing the NHS leadership who were in front of me about recruitment, and was being assured that recruitment was going well and was contributing towards the increases in performance and capacity that we're seeing in the health service. But Dr Singh is giving me contrary information there. So this is a sort of 1 week warning to my health service leadership who'll be in front of me next Tuesday, that this will be an issue we'll be talking about next Tuesday.
Mm-hmm. Well, it's the beauty of a phone-in, isn't it, Mr Swinney, that you can actually speak directly and hear directly from the people. Dr Sharandeep Singh's got another 5 minutes to give us, and so we'd love to get a bit more detail on that situation that you were talking about, Sharandeep. You did seem to stop the First Minister in his tracks there, and he said that what you were telling him was in direct contradiction to what his officials were telling him. I mean, what position are you? You're a doctor, but clearly you are speaking to others in your profession. Where are you getting your information from?
So yes, thank you, Kate. I was quite surprised to hear the First Minister's answer, but I'm reassured by his response that he's going to look into this a bit more. I'm a bit disappointed that he didn't really know exactly what the issue is that we're facing, because pretty much every organisation in the medical field has been shouting and screaming about this issue on the rooftops for the last couple of years. We've seen this coming. There's been every year in Scotland, we are graduating more medical students than there are jobs that the Scottish Government are providing. All of your listeners will understand that is a recipe for
But he said there are
unemployment.
vacancies.
So as I tried to explain, I didn't get into to speak to the First Minister again there. The point about vacancies is very, very nuanced. So the vacancies that the First Minister might be talking about are the vacancies for a fully qualified specialist. And those are very, very particular specialties and very, very particular specialisms, which take between 10 and 15 years for you to get to. So the situation we're getting just now is that the governments across the UK, this is not just being seen in the Scottish Government, but they are pumping up the number of medical schools and graduating doctors into the start of their career. And now for the last couple of years, we're seeing those very same doctors now bumping elbows with each other, trying to fight over for the few jobs that are available. So I personally know, and I personally applied for jobs where I was one of 200 or 300 doctors applying for one post. That gives you a level of the competition and severity of that situation that we're facing now, where we actually have a level of numbers where doctors are available to work, and that includes both graduates from the UK and also international doctors as well. But we're now in a situation where patients desperate to see a doctor are not being provided that doctor by the government. That is the real nub of the issue now. The doctors are there, ready, applying for those jobs, waiting to work. The patients are there in desperate need to see a doctor, but we're not getting the jobs and we're not getting the training, crucially, we need to get to that specialism.
Right.
One of the most shocking stories that came into my came into my notice a few months ago was from Aberdeen. In Grampian, where there's been such a severe shortage of pathologists, which is a consultant-level doctor that carries out, tests for cancer, and they do post-mortems and things. There's such a severe shortage of pathologists in Grampian that they've actually now got the criminal justice system doing the post-mortems for the hospital. That's unheard of. That is a collapse that is unheard of. And when it comes to training up more pathologists, we've seen that there's a cap on those posts. So young doctors that want to become a specialist and consultant pathologist in Scotland are now unable to get into that training programme and unable to get into that training post. So it's a bit of a vicious circle now.
Yeah.
And I really hope that by having that moment to talk to the First Minister, that we're able to really raise this issue at the highest level, because the bureaucracy in the health service is basically just at a total stasis on this issue. There's been no recognition of the problem, and there's not really been that urgency to resolve this situation, which is really leading to a lot of personal stress and personal distress for young doctors.
Yep.
We've got people that are now choosing between being unemployed in Scotland or getting a job in Australia. And that's people that have been publicly funded by us taxpayers to become doctors. And we're now exporting our doctors to the world. That is a ludicrous situation that we're in. And we need an urgency to solve this problem, not just a review and not just a little chit-chat round a table. We need an urgency to really stop this issue in its tracks and turn it around.
Yeah, and of course the details will be very different, but it's interesting. Our first caller was Caitlin, who was a teacher, who was saying that she had been on a temporary contract, I think, for 3 or 4 years, and that was also the future. And she was saying that many others are in that same situation, that they just can't, get their feet under the table, if you like, to progress their careers and go forward and have some kind of, constancy, in their life and in, their professional lives. So, Sharandeep, going back to the situation that you've outlined for us, what do you believe would need to change?
So I think we've got to look at the specific grade that I'm talking about. So I'm talking about doctors here that have graduated from a Scottish Medical School, that have gone through their initial 2-year training programme, and then they're trying to get into a specialist training post. So that is the phase of career that we're really seeing the problems arriving at. So these are doctors in their 20s that have excelled, passed all their exams, achieved everything that was asked of them, and are now asking the government to give us as an opportunity to become a surgeon, to become an anaesthetist, to become a consultant physician. Yes, some of them are even trying to become GPs, and they're being rejected from becoming a GP in a GP training program. That is the ludicrous situation that we're in. And just as you mentioned, your previous caller there, a teacher saying that they're giving temporary contracts. Temporary contracts are an absolute facet now of the NHS Scotland, the way the NHS Scotland is employing doctors. We're all employed, well, not all of us, sorry, pardon me. Many of us are being having to choose 12-month posts where we're on fixed-term posts and we're going from pillar to post every few months trying to find a job. Each time that 12-month post is coming to an end. And that is no way to build a sustainable workforce. So what we want to see is, a bit more stability introduced into it. And all of the professional organisations have got enough information and enough advice to give to this government. But what we need is this government to listen and to commit to that plan. So we need that proper career pathway restored. We need stability for doctors to have the assurance that if they come to medical school in Scotland to study here, they will be given that next phase of training, and then that will build that stability into their life. They can put down roots, and if they've got a training programme in Aberdeen or if they've got a training programme in Edinburgh, they'll be there for 3, 5, 7 years. They'll become a specialist, and they're more likely to stay in that area and become a consultant for 30 or 40 years.
Yeah.
But what we're doing now is we're displacing those young career professionals from putting down those roots, and we're really forcing them into a position where they're having to choose to go work abroad in order to become, a career professional in another country.
I mean, Sharandeep, this may not be your kind of field, but given that the kind of headline statement in John Swinney's programme for government was about 100,000 new appointments in GP surgeries, and we've got to be specific about that, not necessarily with GPs, but in GP surgeries, trying to tackle the 8 a.m. rush, as he identified. And that's not the only measure. He did say there was a package of measures, trying to boost pharmacy first, and I think there are other elements to it as well. But do you see that as a good move?
I'm not a GP myself. I work in the hospital service, so there will be the professionals that can really give their unique insight into that. But I do have that same scepticism that's being voiced. There's that caveat that these are appointments in a GP surgery. Well, we want appointments with our GP. We want to be able to see our GP regularly over the course of our life, to get to know them, to build a relationship with them. We used to call that continuity of care, where the GP would be your GP and you would know them by name and they would know you and they would see you through your life and they would be able to monitor your health and pick up on the subtle changes. And that was the expertise that we used to be provided with. That, I'm afraid, is a long and distant dream now. So firstly, on the numbers, 100,000 appointments in a year, it's a drop in the ocean. It's barely a drop in the ocean, to be honest. GPs are providing millions and millions of patient contact a day.
Yeah.
I do have a little bit of scepticism why we're putting money into new and different services when we've got a proven model that works. The GP model works. We've had it for decades. So I'm surprised that there hasn't been that push to actually increase the number of GPs, and yet we're asking our pharmacies to do more work when they themselves are struggling to keep themselves afloat. I've seen multiple pharmacies in the areas closed down because they don't get the funding to run their service. And now the pharmacists, instead of doing their job as pharmacists, they're now being asked to do consultations for eczema and hay fever, when those were things that you could very easily go and see your own local GP for. So it seems like they're just introducing this sort of pillar and post. They're directing you here 1 minute and then they're directing you there 1 minute, and it's created a little bit of a confusion and a chaos in the system. I feel that as a patient myself whenever I've had to access health services.
Sharandeep, listen,
we need to bring a bit of order to the system again.
You have given us so much food for thought here. I'm really grateful for your insight. And to be fair to the First Minister, he said he was also grateful for your insight. I wouldn't be surprised if you wouldn't be getting a phone call. Not that is within my gift. But thank you very, very much, Dr. Sharandeep Singh there. We would love to hear from other people who are working within the National Health Service, either to talk to this issue